Well, good afternoon, everyone. Thanks for joining us. I hope everyone's doing well despite the times here. My name is Haley LaRue. I'm a wealth management advisor with Boulay Financial Advisors. And with me today, we have Gina DeMarco from LifeStream Insurance Solutions, here to present on the ins and outs of Medicare. As I'm sure many of you are aware, there are several moving parts when it comes to Medicare and all that entails. So Gina will be walking you through the different parts that make up Medicare, the transition to Medicare enrollment, how Medicare determines how much of a premium to charge, and more. So Gina will have the floor for the first part of the presentation. We'll save at least 15 minutes for Q&A afterwards, but feel free to use that Q&A chat box, the Q&A box at the bottom of the screen here, to ask questions throughout the presentation. If there is a relevant question, I'll try to get that, I'll interrupt Gina, try to get that answered for you, but we'll try to save most of them for the end. This webinar will be recorded too, so each of you that are registered will be receiving a recording afterwards. So to give Gina a proper introduction, so Gina DeMarco is an educator and insurance agent with more than 20 years of experience in the insurance and financial services industry. Gina serves as a resource for her clients, as well as for other agents and advisory firms. With her diverse background, experience, and desire to help others, Gina and her team at LifeStream Insurance Solutions works to provide their clients with tools needed to guide them in selecting the right plans for their individual needs. They ensure their clients are provided with excellent service and independent product options with competitive rates. Gina provides education and tailored recommendations to her clients through independent analysis of their insurance needs. Away from the office, Gina enjoys spending time with her family and friends. And a very fun fact that Gina provided is she enjoys the occasional scuba diving trip, which I've never been, so I'm gonna have to try that afterwards. So welcome, Gina.
Well, thank you for the introduction, Haley, and I'm so glad you are all able to join us today. Hopefully you leave this webinar with some information and not too confused. I'm going to try and make Medicare not boring and not overwhelming and not scary, and that is a challenge. So, of course, we'll look for questions on the way, but we'll start with a very general question. What is Medicare? Medicare is social insurance, so government sort of organized insurance that we all know. It's administered by the Centers for Medicare and Medicaid Services. I'm not sure if you can see my mouse as I bounce around over here. Maybe you can. It provides health coverage to over 44 million people. So that's a lot of management to deal with. It's estimated to raise to almost 80 million in a couple of short years because time flies. Medicare is, of course, designed for people 65 or older, but it helps a lot of folks who are under 65. If you've been on Social Security disability for 24 months, after 24 months, it automatically changes from Social Security disability to Medicare. So if you're permanently disabled, you might end up on Medicare way before age 65. If you're under 65 and have end-stage renal disease or Lou Gehrig's disease, there are a few exceptions to the rules, but those are the general rules. In my office, I see a lot of confusion when I say, you know what, we're going to sign you up for Medicare, and then I lead you to the Social Security website. Medicare is actually processed through Social Security. After it's set up and all the billing is taken care of, then CMS takes over. But it's confusing. I'll go over just the basic alphabet soup of Medicare. The ABCs. Medicare is comprised by Part A and B. This is considered original Medicare in the box. A is hospital insurance. B is medical insurance or your doctor's services. It's estimated that original Medicare only cover about 50% of the average person's medical bills. So people buy supplemental insurance, and we'll go over some of the exceptions and we'll go over some of the supplemental insurance in more detail a couple of times today. First of all, there's Medicare Part C, which is the Medicare Advantage plan. A couple of years ago, Part C included Medicare Advantage plans and cost plans, but they recently reorganized how that is distributed. Then there's Part D. Think D for drugs, your prescription drugs, things typically that you get at the pharmacy that are self-administered. And then there's Part E, which is Medigap. Medigap, the Part E now includes cost plans, but for our purposes today, we're really going to talk just about Medigap. Cost plans were everywhere in Minnesota up until 2019, and now they've been eliminated in 67 Minnesota counties, and we kind of miss them a little bit. Medigap includes plans A through N with a few letters in the alphabet missing there. And one thing I want to point out is Medicare plans are different in different states. They're different in different regions. What you have in Hennepin County, someone in Sherburne County might not be able to get. And by the way, the plans available in Florida, you probably can't get here either. So we have different offerings. Everything is well, not all the plans are regionalized, but there are certainly exceptions to every rule, okay? Medicare, the reason people elect supplemental insurance is because Medicare doesn't cover everything. There's Part A is free if you qualify for Social Security or railroad benefits. But if you don't qualify under your own benefit or someone else's, you can pay up to $458 a month. I do want to point out these are 2020 numbers. Unfortunately and disappointingly, the numbers for next year have not yet been rolled out. Sometimes they're announced by now, but they're a little slow, and there's actually a bill in Congress to kind of change some of the numbers because of the national emergency with COVID-19. I don't know that they're getting very far. Part A has a deductible. It's $1,408 this year per benefit period, which can hit us every 60 days. And again, Part A is hospital insurance. Hopefully we're not going to the hospital every 60 days or with a lapse of 60 days in between. Part B has a premium. So A is free, B is not. The standard premium in 2020 is $144.60. But if you're a higher wage earner, and I'm going to break that down for you later on in the presentation, if you're a higher wage earner, you can pay a lot more for your Medicare Part B. Supplemental coverage is Part C or Medigap. These plans range from $0 a month to over $400 a month, depending on what plan you're on. So you can basically choose to drive a cheap car or an expensive one, and anything in between. Of course, the lower your premium, typically the higher your copays, but supplemental insurance is designed to pick up the gaps that A and B don't cover. For those of you who've had Medicare, it depends on what plan you have. If you have a supplement, you might pay 20% for some services, you might pay nothing, depending on where you're at. And of course, Part D. Part D is drug coverage. Drug coverage in a Part C plan, which is combined, you have a deductible, and then you probably have co-pays for your prescriptions. And this is true on a supplemental standalone plan. Right now, in 2020, the deductible is $435. Next year, the max deductible is going to be $445 for your deductible. A lot of my clients are on inexpensive medications. They may never touch their deductible if you're only on some of the generics, but we'll talk about that in a few minutes as well. Part D plans, there's usually co-pays, there's usually a deductible. And again, just like Part B, if you're a higher wage earner, you're probably going to pay more for your Part D coverage. So, doesn't look like there's questions so far. Are we good? Okay. Medicare doesn't cover everything. So I'm specifically talking about Medicare Part A and B, original Medicare. The reason we buy supplemental insurance is because Medicare doesn't cover prescription drugs. It doesn't cover long-term care. It doesn't cover your eyeglasses or dentist visits. It doesn't cover hearing aids or anything related to that. Unfortunately, no cosmetic surgery. I think we need to write our congressman about that. Routine foot coverage isn't covered. Let's see. Custodial care in a nursing home isn't covered. Most diabetic supplies are not covered. But there's hope. There's Medicare supplemental insurance. So we're going to break down the different parts of the alphabet soup for us, okay? All right. I can talk about, I will cover the donut hole. I see a question there. And yes, we can talk about coverage in other states, but the Part C plans are regionalized. So we'll address that maybe a bit more. All right, this is my sort of cheat sheet when it comes to Medicare and the different parts. Part A is free, again, if you qualify for Social Security or railroad benefits, which I have a couple clients that do. Part B, $144.60, but it can be more. Now, the big question and the reason people come and need help with Medicare is because A and B make sense, even though there's some mixed messages between what's covered under which benefit. The big confusion is, should I get a Part C plan or should I get a Medigap plan? And there's where I come in and help narrow down. Literally, I'm sure if you're turning 65, you're getting a ton of mail, and it's my job to help siphon that out and narrow it down to one or two options for you. So I'm going to give you my silly way to make Part C versus Part E easy to understand. I'm going to use the letter C as in Medicare as if you're going to McDonald's and you're ordering a combo meal deal. I know this sounds weird, but stick with me, it'll make sense. I want you to think of a combo meal deal as your burger, your fries, and your drink. It's your whole meal. Well, your Medicare Part C combo meal deal is your hospital, your doctor, and your drugs. There are exceptions to every rule, of course, but generally speaking, your Medicare combo meal deal gives you your A, your B, and your D, all combined in there. Just like at McDonald's, your Happy Meal, sometimes they'll throw a prize in your Happy Meal. Well, your prize in Medicare Part C plans might be extra benefits. They might throw dental coverage in there. They might give you an option for some vision or eyeglass coverage or hearing aid allowances. Some of them will give you acupuncture coverage. So these change every year. Every company dangles a different carrot under your nose, essentially, for your Part C plan. The Part C contract also can change every year. So for those of you who are on Medicare, you know that open enrollment starts on the 15th. And oh my gosh, just a few days and my phone is not stopping ringing. So these contracts change every year. What you have today, the same company, same plan, might adjust things in the coming year. So this is your chance to say, I like this plan and this company, but now my medical needs have increased and maybe I want a more robust plan. That's an option. Part C, another part of the C of the letter C, is Part C exposes you to co-pays. If you have a Part C plan, you might not have a copay for every single service, but you'll probably have a few copays along the way. The nice thing about the copays is there's a limit on how much they can charge you annually. So there's a max out of pocket. Some of the plans in Minnesota might have a $3,000 or $4,000 max out of pocket. But how that works is, let's say you got the other C in our world right now that's dominating us, COVID-19. If you went to the doctor, went to a specialist, and then went into the hospital, you could have several $100s worth of copays. That max out of pocket is not a deductible. Each of those charges cuts that limit down. So it's kind of not like the deductible you're used to. Most of these plans don't subject you to an annual deductible. A few of them do. And again, Part C, combo meal deal, they include your drug coverage for most of them. Again, the exceptions, I have some clients who are veterans. They're getting their Part D through the VA. We don't have to include it in your plan. There are options.
And Gina, we have a relevant question here. So someone asked, does the federal government provide Part C, D, and E, or is that provided by private insurance carriers?
Really good question, thank you. All of the things you see underneath the large blue box, all insurance is through private insurance companies. Now, that being said, all of the policies have to be approved. So that government entity, CMS, or Centers for Medicaid and Medicare Services, They have to be approved through them. All of the policies are standardized, but as I mentioned in the beginning, some of the standards in Minnesota might not be the standards in Florida. As a matter of fact, Minnesota, Wisconsin, and Massachusetts took the playbook on Medicare supplemental policies, threw them away. They're more standardized in every other state than Minnesota, Wisconsin, and Massachusetts. We broke the rules for some reason. I can't answer why. Does that answer the question? Yes. See, thank you. Right here, if you look on the top, you have to order off of the menu back to my combo meal deal. You can't just say, I want 3 large fries, give me a discount, and call it a combo meal deal. You have to use network providers. So that's an excellent question. Thank you. Again, the C is your Medicare combo meal deal. So there are some restrictions to it, but there are some extra prizes in your Happy Meal. Let's contrast that with Part E. Part E, whoops, wrong button. Part E is a little bit different. And for our purposes today, we're not going to talk about cost plans because that was changed from Part C to Part E as recently as this year. And so they've changed the rules on those a little bit. But Part E, Medigap policies or traditional Medicare supplements, there are no network restrictions. As long as a doctor takes Medicare, they're going to take your Part E policy. So you can go to the Mayo, to the U of M, you can go to your favorite doctor in North Carolina if you have a home there, and these policies will move with you because they are not regional plans. These, as long as the doctor takes Medicare. Do all doctors take Medicare? Absolutely not. There are a lot of specialists that don't. There are a lot of doctors who don't take insurance at all. So just keep in mind that Part C plans, they have to take Medicare and be in your network. Part E plans, they just have to take Medicare. Typically with Part E plans, I'm going to assume for our purposes today that you're taking a Part E Medigap policy and you're electing all of the riders. So all the little bells and whistles that go into that, we're going to elect those for purposes of our conversation today. Typically, you don't have any co-pays. Depending on your year of birth or when your Medicare Part A is effective, you may or may not be subject to a Medicare Part B deductible. So if your Part A started before January of this year, you have no Part A or B, excuse me, B deductible. If your Part A started after January of 2020, you have a Part B deductible of $198 this year. After you pay that, guys, you have no copays if you elect all the riders in your Part E plan, okay, your Medigap plan. But Part C is your combo meal deal. Part E is a la carte ordering. So you have to, you're at a nicer restaurant than McDonald's. You elect your Part A deductible. You might need to elect your Part B deductible. There is no drug coverage. So you have to buy a separate drug policy. And there's no extras. If you want dental insurance, that's an extra charge. If you want eyeglass coverage. So just be aware that Part C, you do have the disadvantage of copays, but you're probably saving money. Part E, if you elect all the riders, there's no disadvantage there because there's no copays, but you don't get the extra prize in your Happy Meal. One other thing I want to point out here is if you are first eligible for Medicare, which doesn't mean right when you turn 65 for most of us, but when you sign up for Medicare, if you elect a Part C plan, so that network-driven combo meal deal, and you decide, you know what, I want to save money. I'm healthy. I never go to the doctor. I'm going to save money because they are generally more cost-effective annually. And in a couple of years, maybe when my health deteriorates, I'm going to get that Part E plan because I want no copays and I don't want to deal with network restrictions. You might not be able to move from a Part C plan to a Medigap plan. You can get into either of them right when you're first eligible, but after that, you might have to go through medical underwriting to go from a C to a Medigap plan. Okay, and I've had more than a few clients turn down for that coverage. They are very stringent because the insurance company assumes all of the remaining costs for your coverage. They want to make sure they're not on the hook for too much. Any questions I need to know about there, Haley?
Oh, you just answered the one that was the question
Oh,
about transitioning from Part C to
oh,
Part D. So nicely
well,
done.
golly, thanks. One thing I didn't touch on it initially here is if you look on the box next to Part B, it says you could be exposed to Part B expenses. Now, all the parts of Medicare cover different things, but I want to point out the difference between Part D for drugs and Part B expenses. Surprisingly, and just to add to the confusion, there are medications that are covered by Part B, and there are other medications that are covered by Part D. So D for drugs, these are typically what you get at your corner drugstore. It includes most medications that are self-administered. So think of your, high blood pressure and cholesterol medications. Part D, D for drug again, covers some vaccinations. A lot of things are covered here. Most of the medications you self-administer are under D for drug. But just to muddy up the water, Part B covers other things. First of all, it covers durable medical equipment, so your CPAPs and infusion pumps, things like that. Some vaccinations are covered under Part B, as in boy, your medical coverage. Part B covers some cancer drugs and some intravenous medications. So when we're thinking about Part B expenses, that I'm going to go back, are part of the expenses you might assume in Part C. I want you to know that with a Part C plan, you might be responsible for up to 20% of Part B drugs and expenses. That's how all of them are in Minnesota right now. Most of them are exposing you to 20% for things like chemo, radiation, dialysis. Again, capped annually at your max out of pocket, but I want you to know that. And because Medicare likes to keep, if they like to keep their staff well employed, there's enough confusion here. If you look at Part B, it covers some vaccinations. Part D covers some vaccinations. Part B covers your flu and pneumonia shot. Part D for drugs covers your shingles vaccine. What does that mean for most of my clients? It means that you go in for your shingles shot and now you are exposed to a deductible and copay. I want to make the distinction, and we will go over the donut hole to cover some of that in a few minutes. Everybody is always concerned, what about all the penalties and fees and expenses? Well, I want you to know, not everyone needs to sign up for Medicare right when they're turning 65. If you are currently an employee on your own or a spouse's work plan as a current employee, not as someone on COBRA, if your policy meets the minimum standards set by Medicare, it's considered credible. If your policy doesn't meet the minimum standards, let's say you're on a health share plan or an individual plan, then you might experience some penalties. There's a late enrollment penalty for not having Part A. This really doesn't affect anybody unless you're new to this country, typically not a citizen, and you decide you want Medicare Part A at a later date. What most of my clients see is Part B and Part D. So Part B, if you don't elect A and then B, for Part B and you're not on a group plan, you can experience a 1% penalty per month for every month you didn't have it, but it's capped at 10% annually. So let's say I'm self-employed, I'm 66 years old, I didn't elect to take Medicare right at 65 and I just don't have any other insurance. Well, I might pay 10% more for my Part B when I sign up for it, and that penalty sticks for the rest of my life. They never get rid of it as long as I have Part B. The same is true with Part D. This one I see more often. Part D, if you don't have a drug plan, so a plan that meets the minimum standards of Medicare, if you're on a work plan, typically they do, but they don't always. You could face a penalty of 1% per month for every month you didn't have a credible drug plan. I run into this more often than you might think. A lot of high deductible plans, if you're on those, they might not meet the minimum standards established by Medicare for their drug plan. So A lot of my clients, we just sign them up for Part A, and then we put them on the cheapest drug plan in the market. So we avoid that penalty because it does follow you for the rest of your life. I want you to know about another little known penalty, HSA contributions. If you're contributing to an HSA before age 65, no problem. If you're contributing to an HSA past age 65, you need to stop your contributions 6 months, a full 6 months, be very careful before you sign up for any part of Medicare. That includes A, B, or D. You lose your benefit, you have a penalty, and I don't think Uncle Sam needs any more of our hard-earned money. There can also be additional penalties and charges for not having Part B or for having Part B and D if you're a higher wage earner. Anything I need to address, Haley?
Yeah, so we have a couple relevant questions here. So one, are premiums included in the total annual out-of-pocket calculation?
No, unfortunately, they are not. I wish they were. Only copays.
So they understand Part B penalty is for every complete 12-month period, not 1% per month, capped at 10 months. Has that changed?
That has not changed. It's per 12-month period, they can only charge you up to 1% per month. So, and then that's if you go 2 years, say a full 24 months, now you have a 20% penalty added to your premium every month for the rest of your life. That answer that one?
Oh, yep, there's a couple more. So can your HSA funds be used to pay for your Medicare premiums?
They're not supposed to. It's supposed to be for your copays, but I'm not an accountant and I don't play one on TV. I understand there's not a good checks and balances system for that, but that's probably more of a question for your team over there at Boulay. So,
yes, we can help answer that.
Good. I'd like that.
All right, so we'll save some more of these for the end here, but I want to make sure you get finished with the presentation.
I appreciate it. All right, so for my clients, let's say you're still working age 65, you're not going to retire for another 3 years. You're going to retire at 68. You need to stop your contributions. If you're on a great group plan, stop your HSA contributions at least 6 months prior to going on to Medicare, and you'll be just fine. But don't take Part A if you're contributing to an HSA, okay? Now let's talk about the excess charges. If you're a higher wage earner, we need to start planning, you, me, and your financial advisor at Boulay, at least 2 years prior to retiring. Here's why. These are the 2020 numbers. I wish I had 2021. They just haven't been released yet. I mentioned at the beginning, the base rate for Part B is $144.60. But here's the individual column on the left, and your joint columns in the middle. Let's say that I'm going to go down to the third box. If your income filing jointly is $218 to $272, you're going to pay $144.60. And if you can see the color coordination up at the top, Part B is highlighted in burgundy. They doubled that for Part B excess charge to higher wage earners. And then D is purple. They charge you another upcharge of $31.50 for being a higher wage earner for your medication. So you're paying $320.70 before we get out the door and add a supplemental policy. I have clients who are in the very bottom category, 500 or above or 750 and above. They're adding another $347 and $76.40 to that base. So you're at $570 almost before we've added supplemental insurance. They, by the way, will look back 2 years for this charge. So I want you to be aware, we planned 2020 based on 2018 income. Now there's a catch because my gosh, there's always a catch when it comes to government-run programs. Here's the catch. If you are, let's say you're retiring in December, I made $1 million this year, but next year, January 1st, my income drops down below $174,000. You can file an appeal. And they're very good actually about processing these. So if your income's going to be lower, we wait for them to send the nasty gram that you have to pay more. You file the appeal. You'll probably have to file it 2 years in a row. But I work very closely with financial advisors to say, all right, we'll keep their income between these thresholds just so we don't have to pay an exorbitant amount of money. Okay? It's a little confusing, but We all want to avoid penalties, fees, and expenses. So how and when do you enroll? This is the biggest challenge that vexes me. Do we have something, Haley?
Yeah, I'll just ask one quick question related to the premiums. So what is the annual inflation rate predicted for premiums over the next 30 years?
Oh my gosh. Uh,
Maybe the
30
next
years.
10 years.
I'm going to say I don't know. When you say premiums, I'm going to say it kind of depends. So this here is your Part B premium. Generally, I've seen it go up anywhere from $2 to $10 annually for Part B. If we're talking, do they discern between the Medicare supplemental premiums, Haley, or Part B premiums?
No, just predicted
Okay,
premium. Yep, just
I'm going to
ditto.
say historically, I have watched cost plans and advantage plans go up and down from year to year with really nominal changes in benefits. So if we're talking supplemental insurance on the Part C or Advantage plans and the cost plans, some of them have gone down over the years. Now, eventually they bump up, but not a lot, generally speaking. If we're talking Medigap, the Part E, those I've seen go up by, $10, $20, $30 a year, and more if you're a tobacco user. So they can rate you higher if you're a tobacco user. 30 years is not something I have a crystal ball on or would pretend to, so I apologize. I've been doing this over 20 years. No one's asked me for a 30-year calculation. Anything else?
One quick question. So the 144.60, is that for an individual or a couple?
That is individually. So if it's a married couple, they're both subject to that if they're on Medicare. So everything I talk here, the filing jointly is the only thing, but is the 144.60 is each if they're both on Medicare.
All right, good for now.
All right. Everyone wants to know, well, I'm nervous because I don't want those penalties I've heard of. So when do you need to sign up? It depends. I want you guys to know that the rules for you and the rates for you might be different than your neighbor, your friend, or your brother, because everything is, when I teach a lot of these classes, I talk about Medicare like it's an onion. As soon as you get past one layer, there's one more underneath. It's going to make you cry. So this is where I see a lot of tears either shed or spared. These are just some of the enrollment periods in Medicare. So we can avoid a lot of things, but I need to make sure that you haven't had a lapse in coverage, and that's going to help you avoid most penalties. If you have credible drug coverage, you won't have a penalty if you're still working at or after age 65. So the general rules, if you're collecting Social Security at age 65, you're automatically going to be enrolled in Medicare Part A and B. So you don't have to worry about the Part B penalty. That doesn't sign you up for a drug plan. That's through a separate insurance company, so you'll have to make a call for that. Again, that's if you're collecting Social Security and if you're not on a credible work plan. Let's say that you're collecting Social Security and you're on a work plan, then you don't need to be signed up for Medicare A or B or anything else for that matter, as long as you're on a work plan, and as long as that plan meets the minimum standards. If you're not collecting Social Security, again, maybe you should apply for Medicare 3 months prior to turning 65. There's a 7-month window when you can apply, 3 months before the month of your birthday, the month of your birthday, and the month after. And just to throw in one more piece of, wrench in the machine, if you're born on the 1st of the month, so let's say my birthday is October 1st, then according to Medicare, I actually turned 65 the month before. I turned 65 on September 1st of that year, because there's funny rules. Most of my clients don't have to worry about their 65th birthday as much as some of us do. Most of us, this last box on the right, most people qualify for a special enrollment period. So if you're still working past age 65, contact me 2-3 months before you retire. that's when we need to start thinking about your situation. Contact me a few months before that if you're contributing to an HSA, because we want to make sure you don't suffer from those penalties. Okay? The biggest question I face and what we're going to wrap up our day with is, what's the difference between the plans? How do I avoid the donut hole? We talked about this earlier, so I'm not going to keep it up on the screen, but just know, finding out what plan is right for you. I ask my clients for a list of their doctors and their medications. I don't need to know why you see somebody. I'm not going to dig into your medical information. But if we select a Part C plan, I need to know who your providers are, because I don't want to recommend a plan where you lose your favorite doctors. Not all drugs are covered by the same formulary, so we need to make sure that I look those up for my clients. Medigap has no network restrictions, so we're going to base things based on your medical needs, your budget, and everything else for that matter. Let's talk about drug coverage. This one gets people in the weeds. I want you to know whether you select a Part C plan where drugs are included in the plan, or a Medigap plan with a separate drug plan. These rules apply to both, okay? Drug plans involve 5 tiers, multiple formulary, and 4 phases, just because we like to be confusing. So 5 tiers, again, this is more Minnesota. There are some companies that have 6 tiers and some that have 4. Tier 1 is the cheapest. This is the level of how expensive is your drug. Tier 1 is generic. Tier 5 is a specialty drug. If you see it advertised on TV, guys, it's probably going to be in the tier 4 or 5 range, okay? That's just how expensive is each drug. In addition, each insurance company might have multiple formularies or lists of drugs that they cover in each of their plans. So a formulary is just a list of drugs covered by each insurance company and their plan. The good news is, I talked about credible coverage earlier. Each company and each plan is required to have at least 2 drugs for each medical class or diagnosis, which means every drug formulary for Medicare has to cover 2 medications for cholesterol, 2 for high blood pressure, 2 for, you name the problem. If it's a common class, they're going to cover 2 medications at least for it. We have to just make sure that we recommend the right one for yours. And then phases. This here is where we're going to get into the donut hole. Somebody asked about that earlier. So let's break it down. I want you to know, before we get into the scariness of the donut hole, it can be scary. It can be something that you need to worry about, but a lot of my clients don't have to be worried about it. So we'll jump into it. There again are 4 phases in this donut hole or coverage gap. Each box that you see on your screen, this is actually updated for 2021. Your deductible is going to be up to $445. Now I say up to because some companies, some plans say, you know what, it's a $250 drug deductible only if you're on tiers 3, 4, and 5. So it depends on your drug plan, okay? That's your deductible. After that, phase 2, you are responsible for up to 25% of the cost of your drug. So let's say it's a $100 medication. Your plan is allowed to charge you up to 25% for that $100 medication, so $25. This is your deductible and your initial coverage phase. In these 2 phases, the total cost for your drugs paid by you and the insurance company gets to equal over $4,000. If your medications are not more than $4,000, you don't need to worry about the donut hole. But let's just say that you're on a lot of insulins, or if you're a severe asthmatic, those are some of the big ones I see. Let's go to diabetes right away. You might enter the coverage gap or dreaded donut hole. Here, this is phase 3. You get to pay up to 25% for brand and generic drugs. The out-of-pocket threshold here is $6,500, but they've been reducing the donut hole a little bit over the last several years. Up to 70% now paid by the manufacturer is included in that $6,500. So once we get past that $6,550 for 2021, you enter the coverage or the catastrophic phase where your prices go down dramatically. is my job as your insurance agent. If you choose to work with me in LifeStream, I try to avoid the donut hole altogether for my clients or push it back as late in the year because this resets every single January. So it can be a little intimidating, but I have some clients who are on oral cancer drugs that are covered under Part D, not B, that hit this right away in February and March. So just know. I keep talking about exceptions to every rule. If you are one of our proud military veterans, I want to thank you for your service. You might qualify for VA benefits or Tricare. Spouses and dependents of military veterans might qualify for CHAMP VA. I am not an expert in this area, but I would say there are 8 levels of VA healthcare. Tricare, if you get it, if you are privileged to have it, it's phenomenal, and you probably don't need supplemental care if you qualify for Tricare. If you qualify for VA healthcare, you might want to look at supplemental insurance. And that's a conversation depending on what level. Do you want to have access to other providers, maybe not included in the VA network? Biggest question, how do I choose what's right for me? What my staff and I do is we analyze your needs. What are your needs today? What are your anticipated needs based on health history? Do you take care of yourself? Is there some family history we need to be concerned about? Are you currently dealing with a medical issue? If you come to me with a chronic condition, you've already got something going on, I might have different advice than I'm not a doctor person. Evaluating your budget. What are your network restrictions? Do you care if you have network restrictions? Do you care if you have co-pays? Do you want additional benefits? You know, if my cousin's a dentist, I might not care about dental care if I get all my treatments for free. Do you accept the max out of pocket and things like that? What I do is I look at each of this is a little confusing, but each color from up to down is a different company. From left to right, I have 2 people. I have Al and Kathy. What I do is I analyze doctors and medications to check which network might be a good idea, and then I analyze prices and benefits. If you say my budget is $100 a month for supplemental insurance, and these are my 10 doctors and my 3 medications, I'm going to make sure that I hope you don't lose doctors and that your medications are covered by the formulary. And that's all I have.
Great, thank you, Gina. That was great information. So I'm going to open it up for some of the questions that didn't get answered during the presentation. So first one here, do you need to qualify for Part E if chosen in the beginning through a medical exam?
Actually, in the beginning, you don't need to take a medical exam to qualify for Part E. If it is when you're first eligible, we sign you up, no health questions asked. So it's actually pretty cool.
Awesome.
Yeah.
So let me get to this question here. So Medicare sends a summary of charges, includes a statement of the max that the patient can be billed for specific service. Can the healthcare facility charge beyond this? And can they charge the patient to make up the difference between the hospital charge and the allowable reimbursement?
It depends. It's the worst answer on earth, but it's the right answer. It depends. First of all, are you seeing a doctor that's inside your network? If you go to a doctor that's outside of your network, they can absolutely charge you the excess charges. Additionally, there's HMOs, PPOs, LPPOs, and so on. So that might be a question where I would want to talk to that person directly, Haley, and ask them what type of plan they have. Generally speaking, if you go outside of your network, you're going to have to pay extra. And that could either be a higher copay through your insurance company or something through the facility. But it depends is the only answer to give. I'm sorry.
Yeah, of course. So could you give 3 reasons why you would either go for Part C or with Medigap?
Let's see. Why would I go for Part C? Part C, again, these plans range dramatically in price and quality, frankly. If I am a holistic-minded person, so I'm going to go to my chiropractor, acupuncture, or healer, and I'm never going to go to a doctor unless I am on death's door, Part C, a low or no premium plan might be right for you. Why pay hundreds of dollars a month for insurance you're not going to use. But if I got cancer, I might go to the doctor, an actual normal physician. A low premium Part C plan might be a great option. For my clients who are healthy or just don't mind network restrictions, don't worry about copays, a Part C can be a cost saving. By the way, Part C plans might not move with you, but they travel throughout the country beautifully in most cases. So budget, health, and history is one reason that you'd go to a Part C instead of an E. Why I might go to an E, I'm going to say chronic condition, concerns about my health in the future. I want more freedom and I have a larger budget. Hopefully that answers that. I'll put yours up here.
That's great. So are there better states to live in that give the best coverage on Medicare?
Oh gosh, I'm going to say if you have a Medigap policy, there's great coverage. There are, at least, I live and work in Minnesota, so I'm much more familiar with our plans, but I have clients who've moved here from Florida. There are some fantastic plans in almost every populated state in the country. The only time I've seen plans that are not as good, if I look harder, I find something else that's pretty good for them in their region as well. So, I'm going to say we're pretty lucky. Minnesota, we have access to the Mayo and a lot of fantastic services. So.
Yeah, absolutely. So you had mentioned for HSA contributions to stop those 6 months prior to qualify for Medicare. If your employee,
I'm sorry, I want to clarify that. You can contribute to your HSA if you are not on Medicare under age 65 up until your 65th birthday. After 65, you need to stop contributions 6 months before going on Medicare. So just to clarify.
Gotcha. So if your employer is contributing to your HSA plan, they can contribute until your 65th birthday.
Yeah, that's my understanding. Again, I'm not an accountant, but it's my understanding my employer can, but I can't.
Okay, perfect.
Yeah.
So next question, someone here is 61 years old. If they do not have employer insurance, when would you recommend them taking a look at Medicare?
If you're not signed up for Social Security, then we need to start that process 2 to 3 months in advance. The world is upside down. I think we're all living in the twilight zone of COVID-19. Medicare applications are still getting processed, but it is taking a little bit longer. So the general rule of thumb is 3 months before the month you turn 65. So if my birthday is on October 15th, I turn 65 October 1st, I need to start that process foreseeably in July. And we can do the application online if, so that's the general rule, 3 months before.
Great. So if you don't sign up for Medicare at 65, so say you're still covered under your employer's insurance, can you still make HSA contributions, which I can probably answer this one. I believe the answer is yes.
Yes.
Unless you're on Medicare, which then you can't after age 65. And will there be a penalty for not signing up for Part A at 65?
Nope. As long as you qualify for Social Security, even if you're not taking it, there's no penalty.
Great. All right, moving down the list here. We got a lot of questions coming in. I believe, so this person's group plan required them to sign up for Part A when they turned 65. Is that common?
It's actually really common. Some group plans, and if you're in the insurance industry, you might know this, but most of us don't know this. When your employer takes out a plan, they decide if you can keep your plan after age 65, and they decide if on your plan you have to sign up for any part of Medicare at age 65 additionally. So some plans are just set up that way. I had a client come to me who did not listen to that rule, was unaware of it. Nobody informed her apparently. And then she ended up in the hospital past age 65. Her plan did not pay the hospital bills, and she has been hounded by creditors ever since.
Yeah.
Because she didn't sign up for Medicare, and the rule was she was supposed to. So they can.
Yep, slippery slope.
Yes, too many rules.
So if their deceased dad was a veteran, do they qualify for Tricare?
Not unless certainly not if you are an adult who doesn't have a disability. If you're a minor, you might qualify under someone's benefit. If you have a disability, you might qualify, but typically no, not unless you have also been a veteran who qualified.
Do you happen to do analysis for people who are not yet Medicare age, so not yet 65, but they're no longer covered under employer insurance?
Absolutely. I work both with Medicare and with folks under age 65. Our hands are kind of tied here in Minnesota when it comes to insurance because of the MinSure program, but I am a broker with MinSure, and I also prefer to work directly with the insurance carrier if I'm able to do so. So yes, I run analysis for both.
Great. How do you charge for your services?
I don't. I work for free. No, how it works. I'm an insurance broker. I'm some independent. You don't pay me anything, but when and by the way, if you work with me, you don't pay a different price than what you would find on the internet. The insurance company pays me a commission instead of paying an internal sales rep. So basically, they pay me to service you annually. My staff and I look at your doctors and medications and analyze your situation to make sure that where you're at today is where you should be in the coming year. So really, you don't pay for my services and you don't pay extra for my services.
Great. So regarding the amount that you pay for premiums based on your income, does that continue throughout your life or just the 2 years before you sign up for Medicare?
That continues until or unless your income drops. So they're going to charge this amount, and they're going to send you a letter that says you owe this even if your income has dropped. So if your income remains high throughout your life, you're going to have to pay that income related adjustment. They look back 2 years. That doesn't necessarily mean you pay it for 2 years. So it's kind of one of those individual situations, but if I made $1 million this year and I become Medicare eligible in January and I'm now making $50,000 below all the thresholds, I file an appeal and I won't have to pay that IRMA, income related adjustment, at all forever, as long as my income remains below that threshold. Does that make sense?
Yeah, and that's great segue to planning here, and that's something that we do at Boulay, but I'll get to that part here after the questions.
Yeah.
So are dependents, such as a spouse, that are covered by a credible plan required to enroll in Medicare at 65? I would assume no, not if they're covered by a plan.
Correct.
Through their employer.
Here's the rule. You either need to be on your own or someone else's active work plan. So the minute you stop becoming an active employee, that's when those penalties could potentially kick in. By the way, COBRA, after age 65, is not considered an active work employee or plan. So COBRA doesn't qualify. You could potentially be subject to those penalties and fees. So we work really closely to make sure we avoid those. There's a little bit of a window, but a lot of folks miss it.
Mm-hmm. So did you say that Part C does not travel with you, but Medigap does?
Part C does not move with you, but Medigap will move with you. Part C, most of the plans travel with you for up to 9 months outside of your plan's service area. So if I live in Minneapolis and I go to Florida for the winter, which I think we should all do, it's warmer, then Part C is going to travel with you beautifully. You come back to Minnesota once every 9 months, because most of them travel for up to 9 months without being out of network, you're just fine. Not all of them, but most of them.
So that being said, if you plan to spend 6 months out of state, do you think that they should have Part E rather than Part C?
Absolutely not. I think either works fine. One thing I do for my clients, if I've got a home in 2 locations, certainly look to see if there's preferred providers, but you're not going to get charged extra with either plan, as long as you're touching base at home every 9 months. With most plans, it depends on your plan.
All right. So do you work, and this seems to be a trend here, a couple questions here. Do you work with people who live outside of Minnesota? So for example, Wisconsin, Tennessee?
I'm going to say the easy answer is no. And it's unfortunate, I apologize, but especially in Wisconsin, which is just our neighbor here, the plans there are so regionalized based on county that they're different. I'm really good at what I do, but I can't really be good at everything. So I do have agents, even in Wisconsin, that I network with and chat with. They don't work with other counties in Wisconsin. So I recommend in Wisconsin, find someone in your own county. Now, I get questions from folks all the time in Arizona. I can recommend 20 agents in Arizona that work with all of Arizona, but Wisconsin's it's a very different animal. So
Sure, of course.
yeah, I wish.
Yeah, I mean, can't expect you to do it all, Gina.
I can't do it all. I am not that good.
Okay, so we have someone here who's asked kind of a personal question for themselves, but perhaps someone could apply it to their situation. So I'm going to go ahead and someone is a full-time employee over the age of 65. Their employer's health insurance company has instituted a policy where if the employee is eligible for Medicare, they will only pay the difference between what they estimate Medicare would pay and the provider bills for services. Effectively, they have gutted their Part B type coverage. They have applied for Medicare Part B. Should they opt out of their employer's coverage and get Part E and D, or stay in the company coverage?
I'm going to say that person we might want to share my phone number with them. Great. Because what I'm going to look at is what does your plan cover versus what can I get you on the Medicare market individually, and either a C or an E plan. So many of these are going to depend. I guess if they're gutting your coverage, why keep it? But that's probably more of an individual question.
Yeah, perfect. So just a couple more questions here. Yep. In general, is Part C cheaper than A, B, D, and gap insurance?
Part C. Now I'm going to go with the plans here in the Twin Cities because most of us are probably here. Part C plans start at $0 a month. That is a $0 premium. So I don't think it gets cheaper than $0. And in this area, they run right to around $200 or so. So B, I can't change Part B. That's $140, so let's go with $150 probably for the coming year or in that range. So B is different, but Part C, why not get a Part C even if you're not paying a premium for it? E is going to start more expensive, generally speaking, if you elect all the riders. My clients who go into Part E take it because it covers all of their bills, so I put all the riders in their policy typically. But that is the most expensive plan in our market.
Mm-hmm, mm-hmm. And last question here that I have on our Q&A at least. You may be able to answer this one. So we have a California resident. We have a California resident who is, they have a Medicare Advantage plan. They pay about $160 a month. Could they switch to original Medicare?
Absolutely. Yep. You can always drop your plan. You just might not be able to pick one up unless you're in an enrollment window. So yeah.
Well, that's all the questions that we have, and good thing, because that's all the questions we have time for. So, thank you everyone so much for your participation today, and a special thanks to Gina for the excellent presentation and Q&A session. For those of you who aren't familiar with Boulay Financial Advisors, we provide comprehensive wealth management to individuals, families, and institutional investors. We talked about a major concern on a lot of retirees' minds with Medicare today, but that is just one piece to a very large financial picture when it comes to a person's holistic financial situation. So our job is to help you make the right decisions regarding your financial life in order to meet your goals and help you get there. So if we can be of any help, please reach out to us or send us an email at learnmore@boulaygroup.com. Again, thank you, Gina. We appreciate your time. And if anybody has any questions for Gina, her contact information, I believe, was on your last slide there, correct?
There, yes.
Yes, right there. So feel free to reach out to Gina, or feel free to reach out to your advisor at Boulay, and we can get you in contact with Gina. But again, thank you so much, Gina. We appreciate it, and I hope everybody has a great day.
Thanks for having me, guys. I appreciate everyone there at Boulay. You have a great day.